And it's important for me to say that it's not just me doing this. It's our entire team of doctors, nurses, respiratory therapists, even cafeteria workers here at the hospital. And what we're doing now is making preparations for a possible surge of patients in the coming weeks. And that includes trying to protect our providers, keep them off quarantine, keep them home for right now. And then also all of us are talking to one another about how we can help each other out in this crisis, whether it's my surgery residents supporting the critical care nurses or physicians helping the ER. There's really a spirit of teamwork here that's been very inspiring.
Part of that teamwork is you now training to be a nurse.
That's correct, Tamron. So what my program has set up for us was a day of training where we learned how to do some of the critical care nursing skills that may be required of us if the pandemic gets worse and we have critical shortages of staff. And so we really were fortunate to have three incredible nurses train us in different skills like administration of medications, administration of blood products or fluids, how to manage all the different machines that these incredible nurses manage in an ICU room on a daily basis. So we were just so incredibly lucky to have them teaching us.
Chris, I'll tell you, I'm sitting here looking at you and we are miles apart. You're on the West Coast, I'm on the East Coast, but I can see the toll. I can see it in your eyes, the size that you are taking. How are you processing this? Again, you are now training to help as a nurse, but the weight, I can see it. I can see it on your face.
Well, the honest answer is that the pandemic has not hit us nearly as hard as some other parts of this country. So the physicians in New York or Seattle or any number of cities across the country are currently doing an incredible amount of work, and our thoughts here are with them. Right now, we're doing our best to prepare. We're doing our best to make sure that our hospital is ready for a possible patient surge. And I can't say how proud I am of everyone in our program, our residents, our surgical leadership, the nurses, the techs. Everyone in this hospital has shown that this crisis is going to bring out the very best in them. So we're ready to go.
And the best is, as you just shout out all of the different staffers, again, never answering the question about yourself, because you're wired to be thinking about the rest of the team. And that's why you chose to step up in the way that you did.
Well, sure. I mean, and Tamron, I'm human, and I have family, and I see all the reports in the news, and we're certainly losing healthcare providers to this disease in Italy, in the United States, all across the world. So, the things I think about are the people I live with, my family, my parents, my sister, my brother, my nephew. These are the people I think about every day. Fortunately, we still are able to work and draw a paycheck, but there's also many people in this country that are going to be affected in ways that are difficult to comprehend economically. And so our thoughts are with them as well.
Absolutely. And again, going back to why we wanted to talk with you in the first place is that we're now also appreciating the role that the person across from us plays. Here you are again going to be a doctor, and your appreciation of the nurse now who will be working alongside of you, I'm sure is forever changed now that you are training to learn the very things that they do every day.
You're absolutely right, Tamron. I mean, the amount of respect I walked away from that training with for my nursing colleagues is immeasurable. For the most part, I'm in the operating room all day, and I don't even realize the dozens and dozens, even hundreds of things a nurse does throughout the entire day that I'm not even aware of, that they don't call me about because they're so skilled and are incredible at their job. And so it's important to say that nurses are, without question, the backbone of the American healthcare system. Without them, everything stops. And it's my belief that the nursing corps in this country is what's going to get us through this. And so for everyone out there who knows a nurse, I really encourage you to reach out and thank them during this time.
Dr. Chris, thank you. Thank you to the nursing team you're working with in LA and for your incredible perspective. I can't tell you how much I appreciate your words today. Thank you again.
Thank you, Tam.